My name is George Demiris. I'm the Associate Dean for Research and Innovation in the School of Nursing here at the University of Pennsylvania. I've been at the University of Pennsylvania since 2018. I have a joint appointment in the School of Nursing and also in the Department of Biostatistics, Epidemiology, and Informatics in the School of Medicine. I have always had a great interest in ways to improve the lives of older adults, and nursing science provides us with the tools to help older adults and their families, not only in clinical settings, but also in homes and communities. Nursing captures the patient's voice, so I thought nursing science was the right tool to actually empower older adults and their families. Older adults age, they want to stay independent for as long as possible at the residence of their choice, rather than have to transfer settings of care every time their healthcare needs change. So we have to find solutions to allow people to maximize their potential and live with safety and independence at the residence of their choice for as long as possible. The use of technology can play a role in that, but it cannot replace the actual human touch. My background is in health informatics, so artificial intelligence has always been a concept that has been at the core of system designers when thinking about powerful tools in healthcare. But obviously, more recently, artificial intelligence has experienced an explosion in terms of proliferation within healthcare, and we have high expectations in terms of how AI may actually improve quality of care, improve efficiencies in the workflow in healthcare, but also help us make better decisions when it comes to diagnosis or treatment. And nursing has a great role to play at that because nursing captures the patient's voice. So as we design AI systems, we need to have the nursing expertise that can actually represent patients' wishes, desires, and preferences, and also create systems that will actually translate into the real world and will make a real world impact. As we see the growth of AI, there's more and more questions about ethical implications and what's appropriate in terms of using AI. And I think nursing science can actually help us figure out if and how AI is to be used and what the framework might be for its appropriate and transparent use within healthcare. I have been interested in finding ways to support older adults so they can stay at home independent. And as we're thinking about technologies for aging in place, the use of passive sensing has great potential because those are sensors that are low cost, can be embedded in the residential infrastructure without relying on an individual having to learn new hardware or software. As we started using more and more smart home sensors, we realized that we had a really large amount of data, and AI tools can help us make more sense of this data and actually allow us to predict what may happen. The point here is not to have a human at the other end look at those data points as they come in real time, but rather to develop the right and efficient algorithms so we can prevent something from happening. We can detect when there seems to be a deviation from what would be the normal pattern for an individual and actually carry out an intervention in an earlier time point so we can actually prevent an adverse event from happening. Falls are a critical challenge in gerontology, and cognitive impairment and housing conditions can be risk factors. Actually, older adults with cognitive impairment and those living in low-income housing are at a much higher risk of falling than other older adults. We have been looking at the use of passive sensing to actually facilitate a nursing-driven fall prevention intervention called Sense for Safety. In this project, we use depth sensors that are installed in the home and actually capture a silhouette extraction so that we can get information about somebody's gait, their gait speed, their stride length, their balance. This information can help us calculate an individual's fall risk score, and that allows for a more tailored intervention, both an educational intervention, letting people know what they can do to stay independent, but also an exercise intervention. Exercises that people can do based on their own needs and mobility levels. So in our project, Sense for Safety, we use the sensor data to have a coach provide tailored recommendations for older adults, allowing them to stay safe at home. As we see an individual's fall risk score change, we implement these tailored interventions in a timely fashion to ensure that the person does not experience the fall. At the same time, we want that information about individuals' gait and overall risk for falling to be shared with older adults and their family members, so that that can also inform other interventions or changes that people may want to make in their life, including in some cases improving housing conditions with low-cost fixes such as removing fall hazards or improving lighting or removing objects from the floor. The goal with Sense for Safety is to improve functioning and overall safety for individuals with cognitive impairment who live alone and are therefore at high risk for falling. Artificial intelligence can also play a great role for other health-related aspects of daily living, including health monitoring, medication adherence. But what we see more lately is a lot of generative AI tools that are specifically designed to address social isolation and loneliness. So many solutions are actually creating virtual partners or conversational agents for older adults so that they can engage them in conversations, engage them cognitively, and in some cases provide entertainment, reminiscence therapy, or other type of mental health support. As we think about the use of AI, especially in the home setting, we have to address people's concerns about privacy, how intrusive these systems may be, whether people can actually maintain those systems in their homes, whether they may be stigmatizing, or what the impact may be of these technologies on human relationships. What I have found interesting over the years is that people are definitely becoming more accepting of new technologies, including AI technologies. In the earlier years of my research, in the late 90s and early 2000s, people had significant reservations even about motion sensors. I think as we see more and more of these technologies being used, commercially available solutions for entertainment, for security, people are becoming more open about these technologies, but at the same time, there's always the concern about data, who accesses the data, who can I share the data with, and what may be risks that I can't necessarily understand now, but could be future risks as information about my day-to-day activities are being stored on a server. In the Sense for Safety project, we were able to deploy the system and deliver the intervention in 90 households. Those were older adults who lived in the community alone in low-income housing. And we have some very encouraging findings. We found that the way the technology calculates gait characteristics and fall risk scores really correlates highly with the clinical assessment by a clinical expert who visited our participants every quarter to perform in-person functional assessments. That means that this technology could actually be a reliable way of understanding when people's needs change and when the risk for falls might increase, which actually would allow us to intervene earlier. The next phase for us is to conduct a clinical trial where we actually randomize participants into standard care or a control group and the Sense for Safety intervention to actually see what is the impact on detecting falls and keeping people safe over longer periods of time. Additionally, a goal we have is to continue to explore how the system can provide information that's meaningful and actionable for our older adult participants. That means how can we share gait data, not just with visualization and graphs, but perhaps using generative AI to create conversations or short narratives about people's gait, about their overall functional performance, about their own needs, and find ways to engage family members and other trusted others in this process to ensure that people can actually have control of their own data and share data with the stakeholders they identify as the appropriate ones. I think AI can play a great role globally to support aging, not only in the homes and communities like the examples that are more relevant to my own research, but also in clinical settings when it comes to improving diagnostic and treatment options. I'm part of an initiative called Penn AI Tech, the Penn Artificial Intelligence and Technology Collaboratory for Healthy Aging, which is funded by the National Institute on Aging. This collaboratory aims to fund pilots that explore the use of AI to support older adults in a variety of settings, including older adults with Alzheimer's disease and their families. And what we have found is that AI has great potential being used not only as a system for older adults in their homes, but also in clinical sites for better diagnostic options, for medical imaging, for monitoring treatment options, for even helping us better understand biology of aging and etiology of diseases. So it carries great potential in improving lives of older adults, but also Alzheimer's care at all levels, the biological, the clinical, the translational, and hopefully will create new solutions for some of these challenges that we have been working on in gerontology, not only in the US, but worldwide. In nursing, there's great concern whether the rise of AI means that ultimately some nursing jobs may be eliminated or replaced by robotic tools or other AI systems. I believe we will have to do things differently, but we will not be able to replace the human touch. So I don't think it's a question of whether AI will replace nurses, but rather how can we equip nurses to be better consumers of AI. Nurses will ultimately be the ones ensuring that these technologies are designed and used appropriately. They will be the patient's advocates. They will be the ones who are actually interacting directly with the patient in a variety of settings. So I don't see a question of replacing nurses with technology, but I do think there is a great opportunity in better preparing nurses to effectively integrate these technology tools and AI in their daily practice. We do have to think differently when we think about the nursing curriculum, but this is, I think, an amazing opportunity to unleash the potential of AI to do more rather than worry about nurses not being part of the equation. Penn Nursing has recognized the great potential that AI has both for clinical practice and education. And so as a result, we have already explored ways how AI can become integrated into nursing research, but also nursing practice. Our researchers are using AI tools. We have nurse scientists specifically studying AI in the healthcare context. And furthermore, we're integrating AI into our curriculum by finding ways to explore how AI can become a powerful tool for nurses and clinicians in general. I think we have the ability to also introduce the ethical concerns that may come from the use of AI and actually exploring the different frameworks that can ensure accountability and transparency for our AI systems. We have to look at AI and its integration in healthcare not only from a technical or practical point of view, but also in terms of the clinical implications, the ethical and policy implications that result from this work. So I think nurses are uniquely positioned to explore these challenges and more proactively address them before we see the wide deployment of AI in healthcare settings. What I find really exciting about Penn AI is that this is an interdisciplinary initiative that involves participants, scientists, experts, and trainees from all schools on campus. So it allows us to explore these important opportunities and challenges in the space of AI, but in a truly interdisciplinary fashion, and bringing expertise from so many different professional backgrounds that we can collectively, more in an integrated fashion, address these challenges and accelerate innovation. Nursing has a long history of collaborating with a lot of disciplines on campus, especially with medicine and engineering, where we have a lot of initiatives and projects where we work collectively. And I think in the space of AI, we have a unique opportunity to partner not only with these schools, but also with others when we think about the legal implications, the communication challenges that arise from AI in healthcare. So I think it's a great time for nursing to expand and diversify those collaboration opportunities. Within Penn AI Tech specifically, our collaboratory for AI for aging, we already work with the School of Medicine and the School of Engineering, as well as with Wharton, to explore some of these opportunities specifically for aging. And I think those same interdisciplinary opportunities obviously apply to the use of AI across the lifespan and not just for healthcare settings. One of the great applications of AI in nursing that actually many investigators here on Penn campus have taken the lead in has to do with ambient listening. The idea that you can use AI to improve the note-taking process. that potentially could be significant for the nursing workflow, where clinical notes and documentation take up a significant amount of the daily activities of a nurse. Having trustworthy, reliable, and valid AI tools that can improve the clinical notes and clinical note documentation component can actually free up time for more meaningful communication with the patient and the families.